It's almost like the perfect kind of virus for our society, by which I mean that it can do the maximum amounts of economic disruption because it's just contagious enough and just deadly enough to make problems in that kind of way. The SARS virus back in 2003 was actually deadlier than the one we're seeing now. I think the final fatality rate for cases in 2003 was about 10%. The big difference is that first SARS back in 2003 was a lot less contagious. It really only spread widely in certain kinds of environments. It spread widely in hospitals, especially early on before they were taking proper infection precautions. I think COVID-19 is going to have a terribly negative effect on the image of the U.S. I think already we've seen politically really a lack of leadership from the White House in terms of responding to this. But more than that, I see like a real blow to the U.S. as a medical and scientific power. The CDC, the Centers for Disease Control, was always the gold standard when it came to disease response. And to a certain extent, they've been kind of missing in action with this one. There's going to be real feelings of isolation coming out of this. It's going to be hard to go back to normal. I think among children it's going to be very hard. I think they're going to really absorb this, and it might make them act in a very anxious and fearful way going forward. In China, actually, there were some early studies that indicated that you were seeing real spikes in anxiety around what it was, because of the impacts of being kept in your apartment for months on end. We've had worse viruses emerge from nature in the past. That could definitely happen again. And we're seeing that happen more and more because you see more connection between animals and human beings. That's generally how these things start. And of course, we have a much more globally connected society, so viruses are very unlikely to die out.